Moms, we see you.
That first year home was really rough.
If they were listening to me, it would have been caught much earlier.
We have to do better.
We shouldn't be losing moms.
We are fighting with you and fighting for you. Join the movement to ensure every mom and baby is healthy and gets the advocacy, research, and support they need.
March of Dimes is a beacon of hope to families. They know that they're not going through it alone.
Let's take action for all moms and babies. March for Babies, a mother of a movement.
Welcome to the 2021 March for Babies virtual experience celebration. Thank you for being a part of a mother of a movement. You're changing the lives of so many families, and what an impact you've made. Over the last year, 4 million babies received life-saving newborn screening. 19 million women were reached through our programs, education, and resources. More than 150 state legislative bills were passed to advocate for the health of moms and babies. And investments in critical research began uncovering the impact of COVID-19 to their health. But with so much work to be done, there's no stopping now. We must end preventable preterm birth. We must end preventable maternal health risks and death. And we must fight for health equity for all moms and families. The steps you take today will help us get there. Enjoy the celebration in your march, and together we're creating something big. March for Babies, a mother of a movement.
Well, hi, everybody. It's Daryl Waltrip, and thank you so much for coming out and supporting March for Babies.
Hi, everybody. I'm your host, Mark Garrow from the Performance Racing Network, and I am thrilled to be here with you today. Thank you for being with us at our March for Babies virtual experience. We're grateful that you've joined the movement here in Tennessee. Today is our day to celebrate our children and your fundraising accomplishments. It's also a day to remember and reflect on the precious lives we've lost and the work that still needs to be done to make sure that every family has the best possible start. Unfortunately, the U.S. remains among the most dangerous among developed nations for childbirth, especially for women and babies of color. With preterm birth and maternal death rates continuing to rise, we need to unite, connect, and fight for all families. March for Babies, a mother of a movement, is an opportunity to make a visible difference in our community now and for generations to come. By joining this movement, you're lifting up communities for health equity, opening the door for all moms to have access to care, and protecting the health of families by pushing for their rights. We're all connected by our support for March of Dimes, and we're connected by our stories. Now let's hear from some amazing families and participants in our community who will share their very own.
Hello, everybody. My name is Amber Price. I am the Vice President for the HCA TriStar Division for Women and Children Services, and I'm the Chief Operating Officer at Centennial Medical Center for Women and Children. It is my pleasure to talk to you today about HCA's partnership with the March of Dimes and my personal involvement with the March of Dimes. I began my career as a certified nurse midwife and partnered with the March of Dimes for many years in order to improve the outcomes for women and children in several regions in the United States. Here in Tennessee, the focus in my current role has been to do everything we can to provide optimal care to moms and babies in our community and to improve those outcomes. In the state of Tennessee, the maternal mortality rate is 1 in 1,000, which is absolutely unforgivable. Many of those deaths are preventable. HCA partners with the March of Dimes to disseminate information that directly helps improve the outcomes of these women and their babies. One of the ways we did that this year is to create a panel that was accessible to the community where women could ask questions about honoring their birth plans and understanding what the dangers were during COVID. And we had frank conversations around that had a direct impact on the outcome that helped women feel comfortable with the healthcare system and seek the care that they absolutely needed. Disseminating information to communities, people who are underserved, people who have restrictions around access to care is incredibly important. And the March of Dimes has done a great job in working with us, the hospital system, to have these frank conversations with the community that help people bridge these relationships and know where to seek the care that they need to find that support in the hospital. We've kept our doors open during this time. We've welcomed women in, and we've been able to partner with the March of Dimes to get the right messaging out that helps people feel that like they're heard. We know that one of the things that women absolutely need is to have somebody who's listening to them, particularly women of color. We know that racism has a big component in a maternal mortality crisis, and we're not afraid to have really frank conversations around what it's like to be Black in the healthcare system and seek care that is not only affirming, but that keeps women safe in this system. We're thankful to the March of Dimes for having difficult discussions around diversity and around equity as well. Our goal is to be the safest place to have a baby in this country, and the March of Dimes is a phenomenal partner for us as we seek to execute that big goal every year. I will tell you that I'm personally volunteering to take a pie to the face. My staff is raising money right now and can't wait to do that. So thank you to everybody else who's putting that on the line and who's participating in fundraising right now and who's already generously donated. I urge you, if you haven't donated yet, to think about the people in your lives, the women that you know who've said in anxious moments in the middle of the night with the baby in the NICU, the people who are afraid to come into the hospital and have a baby because of COVID. Please consider it. We will make sure that all of those funds get put to good use, not just locally, but nationally. Again, thank you for your participation.
Hello, this is Karen and Kanga, and we're checking in from the March of Dimes NICU Family Support Program in Memphis. Well, we're getting ready for the Kangaroo-a-thon, but we wanted to pause and just say thank you to all of the amazing and incredible NICU nurses who are supporting March for Babies this year. You are our real superheroes, and we just want to say thanks. Thanks for all you do.
Hi, I'm Kayla Miranda. I'm your co-chair for March for Babies. I want to take a special moment to stop and reflect on all of those that we have loved and lost. If you'd like to share your story, we would love to hear it. Please do so in the comments, and then we also invite you to join us in the memorial tent below. Whether you suffered a devastating loss, or you had a preemie, or you suffered serious maternal health complications from your pregnancy, or maybe you were a mom and a dad that had an amazing helping hand in the NICU. You are why we march. You are the reason why we're here. This whole event is about you. We are so grateful that you're here and that you're on our team. We want to say a special thank you to our incredible sponsors and our amazing top fundraisers. This year has been tough, to say the least, and to have this overwhelming of a response is enough to warm your heart. So we're so grateful for all of your contributions and your hard work. We notice every single little thing that you've done, and we're so, so grateful that you're on our team. We want to say a special thank you to our platinum sponsor, TriStar Health, and our silver sponsors, Monroe Carroll Jr. Children's Hospital at Vanderbilt, Mednax, and First Baptist of Murfreesboro. Our bronze sponsors, Cigna, Tenaloom, Jocelyn & Son Signs, and our media sponsor, Mix 92.9.
Hi everyone, my name is Bobby Jocelyn and I'm so excited to serve as the chair this year for such an incredible cause. I feel so privileged to be able to work with all of you to help improve the lives of moms and babies. So again, thank you for being here and supporting March of Dimes. And thank you to all the incredible teams that joined us at our drive-through celebration a couple of weeks ago. This campaign would not have been possible without the help of our incredible executive leadership team. Thank you for all your hard work. Another big thank you to our top teams who are still going strong. We may be nearing the end of our virtual experience, but our march is just beginning. We've surpassed our goal of $210,000 and we're still going strong. Everyone can continue fundraising through June the 30th to earn rewards through our new March for Babies, a Mother of Movement loyalty and recognition program.
Now, before we go, I want to remind you that our virtual experience site and tents are open now, so please be sure to click around and check out the tents below. They have information about our sponsors, as well as more mission information about March of Dimes. March for Babies is about so much more than today. It's a mother of a movement, transforming the health and lives of all moms, babies, and families, and it wouldn't be possible without you. So in the words of Elvis, thank you. Thank you very much. I'm Mark Garrow. Have a great day, everybody.